I get the knee to 90 degrees and do an anterior draw test. So I sit on the patient's foot and get them to relax. It's obviously easy when they're asleep. And I place my thumbs on the joint line, and then I pull towards me firmly. And I'm feeling and looking at the joint and seeing whether the tibia translates forward. And I can feel that translating forward more than normal. Then at about 30 degrees, place again my thumb on the joint line. It just increases the sensitivity of the test, and my hand behind. So I'm controlling the thigh with my left hand, and then just pulling up. So I'm not having to grip tightly. I'm really just pulling from behind and feeling on the top. And again, you can feel that anterior translation. It's called the LACHMAN'S test. And then the final test is a pivot shift test, where I start with the knee fully extended and a push into valgus and also internally rotate. And what that does is that actually causes the femur to subluxate off the back of the tibia. And then as I flex it, it just clunks a little bit as it reduces. And again, that's more of a feel thing than a visual thing.